So now that we're all relaxed, let's talk about trauma. So today we are going to define what trauma is. We're going to talk about adverse childhood events, the long-term impact and outcomes of ACEs or trauma. We're also going to talk about some prevention and risk factors of ACEs. We're going to discuss resilience and the 7 C's as defined by Ginsberg. We're also going to talk about what we can do to build resilience, such as self-care for ourselves, our community. And I'm going to talk to you a little bit more about mindfulness and self-compassion, and then finally we'll close with some time for some questions. So what is trauma? Trauma, as defined by the American Psychological Association, is the exposure to actual or threatened death, serious injury, or sexual violence. It is a very specific and I think it's a little bit closed of a definition because you need to have direct exposure, have witnessed in person, or indirectly learned that a close relative or friend was exposed to trauma, or in the case of first responders, you can have repeated and extreme indirect exposure, such as responding to scenes of crimes and accidents. Trauma has a long-lasting negative effect on mental health and physical well-being, and trauma is very common. About 70% of people have experienced some type of trauma. However, only about 6% of this develops into post-traumatic stress disorder. So what are adverse childhood events? ACEs, or adverse childhood events, are potentially traumatic events that occur in childhood between the ages of birth, even during pregnancy, up to age 17. A lot of times clinicians define trauma as like big T trauma and little t trauma. Big T is the APA definition where you have, a serious accident, threat of violence, or something bad happening. Little t can also be, things like adverse childhood events, such as not having clean clothes or having food insecurity, not having consistent and caring caregivers that care about your emotional states and problems. Additional things like having family members who live with mental disorders or attempt or die by suicide, witnessing violence, and even experiencing that violence, abuse, and neglect. Internationally, they started to recognize something called complex post-traumatic stress disorder, and it encapsulates more of these adverse childhood events where you have not one single traumatic event, but lots of small traumas over a long period of time. A lot of the symptoms of CPTSD do overlap with PTSD, so you have hypervigilance, mistrust, it changes your belief about yourself and your place in the world, your sense of safety. You also see issues with emotional instability and a higher risk for mental disorders themselves. ACEs are very common. About 64% of the U.S. adult population has experienced at least one ACE before age 18. On your table, I believe we passed out some ACEs questionnaires. And so I'd encourage you to look through these and calculate your own ACE score. Is there anything that you find particularly surprising on this list? Perhaps not. Unfortunately, about 1 in 6 or 17% of those who have had ACEs tend to have 4 or more. And whenever we enter into having multiple types of ACEs, we tend to have a worse outcome on our health. Whenever we have reoccurring, periodic, unpredictable, or sustained traumatic events that can lead to this experience, we can have a buildup of toxic stress. And in this way, we can also have long-term potential health outcomes that are quite negative. In fact, ACEs have a profound negative impact on health and well-being. There are enduring effects on the structure and function of the hippocampus and the amygdala in your brain. And these sites are critical for learning, memory, emotion, and motivation. And the amygdala is the site where we have that fight and flight response. And so whenever we have that chronic stress, oftentimes this can get kicked into hyper overdrive. And so you have individuals who really struggle with interpersonal relationships. They may have chronic tension. And again, they may have physical health issues that come up. You have a greater risk of psychopathology. You may develop earlier and more severe symptoms, and it's less likely to respond to traditional treatments. You also have a greater risk of somatic disorders. Again, when you're in these chronic states of high stress, it really impacts your body and how it functions. So you have dysregulation of your immune system, and you have increased pro-inflammatory markers. And oftentimes you see those in chronic and long-term disabilities or chronic health conditions like arthritis. You also, again, have a greater risk of physical health, things such as cardiovascular disease, obesity, substance use, and diabetes. Does this have a little pointer? Yeah, excellent. So you can see over here, this is actually a chart where the risk level of these different sectors can be attributed to having adverse childhood events. So 65% of your risk for suicide can be attributed to adverse childhood events. 67% of risk is attributed in alcoholism. This is a very substantial number. So we can start to really understand that what's happening in our childhood has very long-term repercussions. And this happens due to pathways to disadvantage. You know, we can see here is the experience of the adverse childhood events on the bottom, and oftentimes that leads to disrupted neurodevelopment. People who have experienced as ACEs have a higher chance for things like ADHD and autism and other neurodevelopmental disorders. And that can again lead to social, emotional, and cognitive impairments, which again increases your risk of high-risk behaviors, impulsive, risky behaviors, and again, those put you at even higher risk for disease, disability, and social dysfunction, all of which leads to early death. Transfer, there it is. So you can see individuals who have had ACEs are 12.2 more times more likely to attempt suicide, 7.4 times more likely to consider themselves an alcoholic. And I want to make the connection. People who have undergone traumatic and harmful events, they turn to substances because they are in pain. It's a way to cope. You know, it's not necessarily a healthy way, but it's getting them to survive. It's a survival mechanism. And so we need to make sure that we're providing different supports within our community to make sure that they don't have to turn to these more destructive behaviors. 10 times more likely to inject drugs, 4 times more likely to experience depression, and each ACE that you accumulate is associated with an estimated 3.3% increase in mortality risk, which is substantial when you think about 17% have experienced 4 or more. So there are different risk factors for ACEs. We can see on the individual side having a lower income, a history of abuse in your own past, your education level, high parenting and economic stress, which, come on, it's very stressful times to live right now. Being isolated, using corporal punishment, having high conflict or negative communication styles, and again, isolation not just of the families, but the children as well. And I think it's very important to not focus on individual risk factors, but rather to look at the community risk factors and see the systems in which these individuals are embedded in. So in the community side, we have high rates of violence and crime, poverty, unemployment, access to drugs and alcohol, few community activities for young people and for adults because adults need community as well, unstable housing and food, and high levels of economic and social disorder, and having limited educational and economic opportunities. Karatikin took this WHO model and modified it, and I really like it because it takes the shift off of these intermediary determinants of health, such as like where you are living, your material circumstances, your own genetic factors, and then the psychosocial factors. So things that are happening like within the home. And it focuses more on the structural determinants of social health, which is where we see a large number of health inequalities and disparities. And this is out of an individual's control. It is unfair to place the burden on an individual to fix things that are systemic. And so we see the places where we live and grow and worship and work have a huge impact on how we are able to access material and housing and food security. And so I think it's very important to, again, remember what are the systemic issues that need to be addressed through policy change, rather than trying to put additional burden on families or individuals who are probably already really struggling. We can also see, social class, gender, race, ethnicity, LGBTQ status, education, occupation, and then your historical wealth deeply impacts, again, your access to a lot of the things that can have an impact on your risk for ACEs, and then your long-term impact on mental health and well-being. So what do we do to prevent ACEs? So as a community, or as a larger system, if we look at policy within the United States, we need to focus on promoting social norms that protect against violence and adversity. These can be happened through like public education, legislative changes, educating young people on bystander interventions, even learning that yourself. When you see something, say something, intervene, speak up. We can also bring in men and boys as allies in prevention, especially against things like sexual assault and sexual violence. We want to make sure our children have a strong start. And so it may be getting with services where you can get in-home child visitations and care, parenting lessons, having high-quality child care. We also want to teach skills, not just individually, but also as a community. We can learn social emotional learning, safe dating and healthy relationship skills, parenting skills, and family relationship approaches. We also want to connect our youth with caring adults in different activities. So we want to have mentoring programs and after-school programs. And it's important to connect young people with individuals from similar backgrounds and stories so they can see themselves achieving the goals and the dreams that they want. We also want to intervene to lessen immediate and long-term harms. And so one of the things is educating people about ACEs. We're doing it right now. We also want to treat and prevent problem behavior and enhance our primary care. And then in the long term, we want to strengthen the economic support to families. This means strengthening household financial security and having family-friendly work policies. Things like maternal leave or parental leave whenever individuals have a child. Resilience can also be really helpful in the prevention and lessening the impact of ACEs. And so resilience is our capacity to adapt within and across systems and processes. Whenever we have resilience, we can see that there are positive outcomes, both on the individual, group, and community level, despite having exposure to serious threats to adaptation or healthy development. I just really loved that definition. So Ginsberg is a pediatrician, and he researched resilience, and he found that there were 7 C's of resilience that we can work on fostering within ourselves, within our children, and also in our community. So competence, focusing on strengths. What can you do right? Oftentimes with ACEs, it can sound very depressing and disheartening of what's happened to you, what's wrong with you. But I think it's helpful when we can start shifting that conversation to what's right with you. How do we build that sense of mastery and competence? And let children and yourselves make mistakes. That's a natural and normal part of human learning. And so whenever we make mistakes and we figure out what we did wrong and we can address it and grow, we build that sense of competence and self-mastery. This is how we also get self-esteem. We want to focus on connections, having physical and emotional safety. In all of my research in preparing for this, most of the positive counter ACEs that I'm seeing is just being emotionally available and present with your child. And honestly with yourselves too. Being able to sit with and tolerate some of those intense emotions, to validate them, to say, hey, it makes sense you're upset. Or I'm really sorry that you're being bullied at school. That must be so hard. Let's talk about some strategies to figure out what's going on. Having someone who is emotionally safe, physically safe, secure, and is a strong source of positive encouragement, it's called a counter ACE, and it's helpful in building this resilience. It's also important to be able to address conflict directly, and so working on our communication skills, and again, being able to validate and sit with sometimes uncomfortable emotions. Contribution, this is serving others, getting involved in the community, having a sense greater than yourself. It can also be getting involved in like a faith-based activity. Control, this is again another important lesson to teach children, is we all have choices. Life does have random chaos in it, but oftentimes things that happen to us that are bad are the result of other people's choices and decisions. And that's out of our control. We can't control other people, but we can control what we do. We can control our reactions. We can control how we grow and move forward. And so I think teaching individuals where you have control, where you don't, and letting them know that discipline is a process of teaching and not punishment is, again, a way to build resilience in yourself and in your children. Confidence is just recognizing when you've done a good job. I want to challenge you the next time you find yourself being very busy and you have a full to-do list. Make a done list. See what you've done right for the day. See if you can say, hey, I've accomplished something. I've done it well. See how that feels. It's also important to notice and encourage persistence, even if we don't succeed. Having a good spirit of trying, being very kind, these are all things that can help whenever we recognize them again in our children and in ourselves to build that sense of confidence. We don't just have to be achieving, we can just be good humans. Character, having a sense of morals, values, and empathy towards others, again, is very important in building resilience. And then coping. We need positive strategies to deal with stress. Stress is an inescapable part of life, but whenever we can model positive coping behaviors to our children and engage in those ourselves, it's more tolerable. We can sit in those uncomfortable seasons. So this is the Empower Action model, and it was developed by Srivastava and colleagues. And I really like this as a model for change when talking about ACEs. So we can see here in the middle that there are a lot of different things. And this is actually depicting a socio-ecological model. And that's whenever an individual is nested within a set of systems and frameworks surrounded by the family, their community, schools, churches, bigger communities, and then we have public policy. And it's important to note that this is not just one direction, but it's bi-directional. And so all of these things can influence the individual, and the individual can influence back out. But we can see on this individual level, we can implement these different factors. Building a sense of resilience in others, sharing resources that allow individuals and families to meet their basic needs, creating positive environments, providing support. Oh, I can't quite read that one. Growing positive outcomes. Maybe someone can help me out what it says. But it's important to see, what can we do to help support our families? What can we do to help support ourselves? And then we have an organization, community, and policy level where those individuals should be responsible to us. We need changes in policy where it's inclusive environments for all families. We need racial equity and inclusion in all policies and practices. And it's important to have strong cultural identities for all families because that gives us the building blocks and foundation for that sense of resilience. And again, like I want to stress, it's important not to focus on the small micro level, but to pull back and see these systems where we're living, growing, and thriving, and hold them accountable for making a better place to live. So some of the common barriers to resilience are an imbalance between work and personal life. I don't know who struggled with that ever. An overexposure to stressful events. And again, I think part of this is the zeitgeist, or the time with which we're living. It is a very stressful and hard time to be alive. We're all exposed, we're all at risk here. We have insufficient time and space to process our negative feelings. We have humiliating experience of discrimination, racism, homophobia, transphobia, and then social isolation. Social isolation is the equivalent to smoking of one whole pack of cigarettes a day on your health. Being lonely and disconnected is deeply harmful as a human. We need those connections. And so we take the words of Audre Lorde and Bell Hooks and we say that self-care is a necessary act. It is rooted in the principles of self-determination, self-preservation, and self-restoration. Self-care is not something you buy. It is not an activity you participate in. It is not bubble baths. It is not a massage. When we look at self-care in this way, it commodifies it, and it can lend towards conversations of who has time for self-care and who deserves self-care. And we all, yes, exactly, who can afford it? We can barely afford groceries. In a face mask, it's not going to do anything. You take it off, your skin's feeling great, but you're still left with all of your problems. It drives me nuts. And so this actually comes from Pooja Lakshmi, who is a neonatal pediatric psychiatrist. And she was looking at self-care as a set of principles and a guiding way to live your life, rather than just one thing that you do. And so it's important, one, to know yourself and your values. When we know what's important to us and we know what we value, we can align our actions with that. When we are living in alignment with our actions, it gives our life meaning and purpose and a sense of fulfillment. And so I'd encourage you, take the time to reflect what's important to me. I love a good worksheet, and you can just Google values lists, and there's so many. And I think it's a wonderful exercise at any point in life to check where you're at and see if you can realign and reintegrate those values into your everyday action. And it's hard. None of these things are easy. It's also important to evaluate your sense of autonomy and power. Like I was saying earlier, a lot of these things are out of our control. There are systemic issues that can keep us from accessing things like care and setting boundaries, especially if they're in unsafe environments. This is particularly problematic whenever we have work-safe environments that are unsafe, and we don't get to say that I need to leave or I need to set a boundary, because you need that financial stability to support your family. And so this is, again, it's a challenging thing to do, but see where your power lies. Where can you actually move a little bit and make a little bit of more space for you? And maybe you can't say, screw your boss, I'm out of here, but maybe you can say, after 5 o'clock, I'm not gonna look at my phone for emails. If you continue to talk to me in this tone, I'm gonna step out from this room. Boundaries dictate our behavior. They tell us what we do. They tell us what we are willing to tolerate. And so again, think where can I set those boundaries?
I tell my kids, we teach people how to treat us.
Absolutely. That's right. If you talk to me like that, I'm out of here. I can't say you can never talk to me like that, because I can't control you, but I can control my own reaction and my behavior. And so I encourage you, see where you can set those boundaries by assessing your autonomy and power. And it may be small changes, but hopefully in the long term, maybe that can shift a little bit further. I also think it is incredibly important to engage in self-compassion. Self-compassion is, we'll just go to the next one. Self-compassion is a form of mindfulness. And it's really just offering ourselves kindness instead of harsh critique and judgment in the times and spaces where we really need it. and it acknowledges the difficulty of the moment. When we think about mindfulness in itself, it's really just cultivating a specific type of awareness. And so it's being present in the moment with a non-judgmental attitude. And we can do this with ourselves through self-compassion. And so it may be, I'm experiencing some very difficult and uncomfortable feelings, and that's okay. I can offer myself validation. It makes sense that I'm hurting. Maybe my child is being bullied at school. It makes me feel helpless. It makes sense that I feel helpless. And we just validate and sit with that uncomfortable feeling. And then after we can sit with ourselves, we can make a good judgment on what to do from there. First step is simply just acknowledging, sitting with it, giving yourself that validation, and then giving yourself the kindness to meet the needs that you're having. Mindfulness is a wonderful tool. I love it because it's completely free. It's accessible to anyone and everyone. And there are many, many different types of mindfulness for you to try to see what works best for you. And really, it's just being present. Some of the ways we can be mindful can be like body scans, like what we did earlier to start. I really love mindful walking. I have to walk to my office every day, and so I'm sure y'all do too. And so when you get out, focus on what do my feet feel like when they hit the ground? What does the air feel like up against my face? What smells are there? What sounds are present? And I promise, instead of thinking and ruminating and worrying about everything, you're going to be more grounded and present and capable to deal with the stresses when you get to your office. Mindfulness is also an implicit memory skill. This is something that we're not consciously aware of cultivating, but our core beliefs, our feelings, our sense of safety come from implicit memory. And so it's something, if we put a drop in the bucket, it's going to build over time. And it doesn't matter if it's one tiny drop or a big fat drop or a big old dollop, A drop in the bucket is a drop in the bucket. So taking 30 seconds to have some deep breaths, taking a few minutes to be present and aware of your body and sensations when you're walking, can have a real long-term lasting impact on your health. Mindfulness has been shown to be related to reduce anxiety and depression. It improves relationship satisfaction. It can improve your memory and cognition. It can even change your vision acuity. There's mindfulness studies where they had people divided into two groups, and they told them athletes have better vision. So one group did jumping jacks and another group did skipping. The group who did jumping jacks, who perceived it as more athletic, had improvements in their vision score. Yeah. And vision, that's not something you're supposed to be able to change. But if we can have changes in our physiological measures and outcomes, think what that's doing for your emotional health. So I'd encourage you, take some time to just be mindful, to be compassionate with yourself, and give yourself grace. One of my favorite self-compassion phrases is, it's really hard being a human. And oh my gosh, it is. So we can also take self-care and blow it up to a sense of community care. And again, it's evaluating and knowing, what are your community values? How do you align your community actions with those values? How can you set up spaces where people feel supported? How can you come together as a whole? And whenever we do this, we're shifting those social determinants of health, those environments where we're living and growing, to make real changes and to make it more accessible and equitable for people who might be struggling more to take care of themselves and their children. It's important to have cultures of empathy, solidarity, and mutual support. We can do this by sharing resources. That's one of the things we're here doing today. We have all of these organizations here who have different resources within the community. Have these conversations amongst yourself. One of the things that I've found in my time at the partnerships is everyone has really great ideas. Everyone has a little pocket of resource, and everyone's spinning their wheels independently. Whenever we can come together and share our resources, we can make a much bigger impact because we're coming together as a whole. And there are so many people who are fighting for the same things. And I know, like, it gets exhausting. And so having that sense of mutual support and care can help build that resilience and endurance that we need to make those long-term changes to the systemic issues that are impacting us. It's also really important to prioritize your well-being. Like Audre Lorde said, like, this is not just an act of self-care, it's self-preservation. We have to do it for ourselves and for our communities. We need to care for ourselves. I don't think I can stress that enough. And so that's what I kind of want to conclude with is, even though, you know, there are 60% of us in here who have experienced some adverse childhood event. That's the majority, and I'd probably rank it a little bit higher. That doesn't have to be your long-term story or outcome. Instead, it's a starting point, and it's up to us to figure out how do we build resilience as individuals and as a community. And when we come together, we can change the story for the future generations. And so I'd love, if anyone has any questions, I'd love to take them.
Can we get your slides?
Absolutely.
Yeah, you're sitting here clicking.
I'm happy to share.
Thank you.
Yeah, what's one of the things is sharing resources, and I am all about it.
Yes, I like it.
Mm-hmm.
Great.
Thank you.
So what do you know more, do you know any more on the correlation between our ACEs and our chronic diseases?
I am not an expert in that. I have been reading some. I'd highly recommend Gabor Mate's Myth of Normal. He's actually an MD who goes into more of the research surrounding some of the issues with repressed emotions such as anger, which if you look at individuals who have more severe psychopathology, processing anger is a big deal. And so when we hold it in, especially if you've been socialized as a woman, it can lead to long-term negative health effects. And what happens is you have high levels of stress, and that impacts your acetylcholine, your glucocorticoids, and that builds up like the system of inflammation. And we have long-term inflammation, it just leads to bad stuff. I'm certainly not a doctor, but I am seeing more and more the connection between our mental health and our physical health. I've seen practitioners who do yoga therapy, and I have practiced yoga myself, where you have release in your body and it causes emotional release. And so one of the things they say in yoga is like you have a lot of emotions stored in your hips. So doing mindful movement, which is yoga, can help release some of that stored emotional tension in your body. Also, engaging in therapy can be very helpful. Being in community, having people who can listen to you and care and validate your struggles, very important. Yeah. But taking care of your mental health is a great way to improve your physical well-being as well. Yes.
Okay. So with ACEs, have there been any studies or to what extent climate change has impacted the extent of ACEs or the long-term effects?
That's a really great question. I really don't know. It's something I'd have to get into the literature and see. I would assume that climate change does have a negative impact on ACEs. I'm going to go back to the social, this one. And so the environment in which we live, if there's toxins in the air, if it's too hot to go outside and play, it's going to be problematic in building up that sense of resilience, and it impacts that like social determinants of health. And so I would imagine they're interconnected. Because, you know, we're animals on this planet, and if the planet is not doing well, then we don't also do well. And so again, like, what is the environment like outside? Is the water safe to drink? Can you go outside and play? Is there toxins in the air? All of this is going to have a long-term impact on your health. Yeah. Mhm.
And obviously, it's going to take a few years before we can start addressing their needs wholly. But what would you say, in your best opinion, is the proper approach to begin the work with them?
Can you repeat that? I couldn't hear.
Yeah, so they work with children of refugees, and they have a lot of community and individual risk factors. So what could you do to kind of start working with children to build up that resilience? Yeah, so first, do some mindfulness. I would encourage them to build up that sense of safety. Being a refugee, I would imagine that their sense of safety and stability has really been disrupted. And so having someone who can be emotionally responsive, safe, and stable is going to help build that. Working on that sense of trust between like the client and yourself, and also the client and their own like bodies. I don't work with children very much, but again, it's just working on that sense of safety, making sure they have emotional resilience. So give them that sense of confidence, of competence. You know, what are they good at? What can they control in their environments? Something to encourage like play and community. Having a space where they could potentially express and talk about and maybe find connection with people who've gone through similar things. But again, just being like emotionally present and validating and caring is going to have a really big impact on those youth. You're welcome. Well, going once, going twice. Thank you.